Welcome to this explainer. Today, we're diving deep into the Chandipura virus outbreak. We'll be breaking down the hard facts, the symptoms you absolutely need to look out for, and the crucial prevention steps being taken right now. We're going to cover exactly what you need to know, how this virus actually operates, and how communities are stepping up to fight back. So let's just jump right in and address the most pressing question on everyone's mind right now. Why is Gujrat suddenly on high alert? Well, to really understand the gravity of the situation, we have to look directly at the numbers coming out of the state's health departments. You see, this isn't just some standard precautionary warning. It is a rapid response to a very real situation that's directly impacting the most vulnerable people in the population, specifically children under the age of 15. And it breaks my heart to say this, but the stark reality is that 22 children have tragically lost their lives during this recent outbreak. That number alone really underscores exactly why health officials and local governments have completely escalated their response. When a viral outbreak begins claiming lives, especially the lives of children, the entire focus has to immediately shift to rapid containment and intensive care. On top of that, out of all the cases reported across the state, 35 children have officially tested positive for the Chandipura virus. Now, while 35 might seem like a small, specific subset, it's actually a critical indicator of the virus's active presence in the region. Tracking these confirmed positive cases is what allows health experts to map the outbreak's epicenter and deploy the resources exactly where they are needed the most. Let's look at this breakdown because it gives us a really complete, unbiased snapshot of what's happening on the ground. Out of a total of 184 suspected cases, we have the 35 positive cases and 22 tragic fatalities we just talked about. But look closely at the rest of this data. We've got 11 cases where test results are still pending, which means, these numbers could definitely shift. However, there is a glimmer of hope here. 6 children have actually successfully recovered and been discharged, and 7 positive patients are currently fighting the virus under specialist care. So it's a very dynamic, ongoing battle. Okay, now that we understand the current scope, let's move right into Section 1. What is the Chandipura virus? The crucial point we need to understand here is that Chandipura vesicular virus, or CHPV for short, is a really rare pathogen from the Rhabdoviridae family. But what makes it so dangerous isn't its scientific name, it's what it actually does to the body. CHPV can lead to acute encephalitis, and if you aren't familiar with that term, acute encephalitis is a highly serious condition that causes severe inflammation of the brain. It's literally this neurological impact that makes the virus so life-threatening if it isn't caught early. Now, you might be thinking this is some brand new unknown threat, right? Actually, scratch that, it's not. The virus gets its name from Chandipura village in Maharashtra, which is where it was first identified way back in 1965. Over the years since then, India has successfully navigated multiple outbreaks, mostly in the western and central states. But what brings us to today is the 2024 outbreak context provided by the World Health Organization. The WHO confirmed a very vital modern detail. They have found absolutely no human-to-human transmission in this current wave. And that WHO finding leads us perfectly into Section 2. How does it spread? Here's a deeply calming fact for the general public. We're all so used to worrying about respiratory viruses, the kind that spread through a sneeze or just being in close contact with someone. But Chandipura is completely different. It relies entirely on insect vectors. It's primarily a vector-borne infection. The main culprits here are sandflies, though mosquitoes and ticks have also been identified as possible vectors. So your primary concern isn't actually being near a sick person, it's being exposed to the infected insects themselves. To really grasp the risk, we have to understand the vector. This virus is incredibly specific to its environment, mostly because the primary vector, the sandfly, lives in very specific habitats. These little insects absolutely thrive in the cracks and crevices of mud walls and inside homes built from sand or mud. This architectural detail completely explains why certain rural communities are disproportionately hit by these outbreaks. The danger is quite literally living right there in the walls. And this brings us to a critical intersection of environment and biology. What's really fascinating and honestly deeply concerning is the timing of it all. Warm, humid monsoon conditions create the absolute perfect storm, greatly favoring the breeding of these insect vectors. When you combine that suddenly booming insect population with the most vulnerable demographic, which is children aged 9 months to 14 years, you get the exact recipe for the outbreaks we are seeing today. So if a child is bitten by an infected sandfly, what happens next? Let's get into Section 3, Warning Signs and Symptoms. The rapid progression of this virus shows exactly why catching it early is absolutely critical. According to the National Center for Disease Control, it happens in stages. Step 1 looks a lot like a common viral infection, fever, vomiting, diarrhea, typical flu-like symptoms. But it can rapidly escalate to Step 2, where it attacks the brain and causes that acute encephalitis. This shows up as seizures, confusion, altered consciousness, or even falling unconscious. If it reaches Step 3, the severe stage, death and tragically occur within a remarkably tight window of just 48 to 72 hours after hospitalization. Look, if you take away nothing else from this explainer, remember this. Act immediately. If you're a parent, teacher, or caregiver and you see a high fever that's quickly followed by vomiting, seizures, or any sudden changes in a child's consciousness, there is no way you can just wait and see if they feel better tomorrow. These escalating symptoms cannot be ignored. Immediate medical attention is literally the only way to get ahead of that rapid 48-hour window. Finally, let's explore how we fight back in Section 4, Prevention and Care. We have to start with a pretty stark medical reality. Currently, there is absolutely no approved vaccine to prevent the Chandipura virus, and there is no specific antiviral treatment designed to cure it. Because modern medicine cannot just stop the virus directly with a pill or a shot, the clinical focus has to immediately shift to intensive supportive care. That means getting the patient into the ICU right away and providing critical interventions, like oxygen or ventilator support, to keep their body fighting while doctors manage that severe brain inflammation. Because the medical treatments are purely supportive, the real battle is actually happening out in the environment. To stop the spread of the source, Gujrat health teams are relying heavily on vector control measures. They're actively conducting intensive pesticide spraying to wipe out the sandflies. They're urging communities to seal up those cracks in the mud walls where the insects hide. And they're doing active surveillance through rigorous door-to-door checks to find potential cases before they become critical. It's a massive, on-the-ground effort. In what is a truly powerful, game-changing move to save lives, the government has actually adjusted its clinical protocols to match the sheer speed of this virus. Both government and private pediatric hospitals have been explicitly directed to admit children showing Chandipura symptoms straight into ICU facilities. They are told, do not wait for laboratory confirmation. When a virus can become fatal in just 48 hours, waiting around for a test result is a luxury these patients simply do not have. This policy ensures absolutely no time is wasted. Amidst all this urgent action, Health Minister Praful Pansaria really hit the nail on the head regarding the mindset we all need to have. He urges citizens to, and I quote, remain calm, disregard rumors, and cooperate fully with visiting health teams. Panic helps absolutely no one during a public health crisis, but relying on the facts, keeping up with environmental hygiene, and just cooperating with the health experts knocking on your door, that is exactly what will protect our communities. So, as we wrap up this explainer, I want to leave you with one final thought. We know this virus has been around since 1965. We know exactly where the sandflies breed, and we know they thrive in the monsoon season. So knowing the rapid progression and these highly specific environmental risks, how can we use this knowledge to ensure our environments are safe long before the next monsoon season even arrives? How can continuous, year-round community vigilance permanently break the cycle of these outbreaks? It's really a question of transforming today's rapid response into tomorrow's lasting prevention. Thank you so much for joining me to explore the facts, and as always, keep learning.